Top 6 Nutrient and 7 Method to Shrink Your Enlarged Prostate. Prostate enlargement, also known as benign prostatic hyperplasia, BPH, is a prevalent condition that affects men as they get older. This condition occurs when the prostate gland, situated just below the bladder and surrounding the urethra, starts to enlarge. Consequently, various urinary symptoms arise. The prostate gland plays a crucial role in reproductive function by producing and secreting a fluid that nourishes and transports sperm during ejaculation. BPH is most commonly observed in men over the age of 50. Studies have indicated that nearly 90% of men over 80 years old experience some degree of prostate enlargement. The growth of the prostate gland exerts pressure on the urethra, leading to a range of urinary symptoms that can cause discomfort and distress in men. The symptoms associated with prostate enlargement, BPH, can manifest in various ways. These may include difficulty initiating urination, a weak urine flow, frequent urination, especially at night, and the sensation of an incomplete emptying of the bladder. Additionally, individuals may experience pain and discomfort in the pelvis, abdomen, and perineal area. If left untreated, BPH can give rise to complications such as prostatitis, an inflammatory condition causing pain in the prostate gland, and urinary tract infections. Furthermore, an enlarged prostate may increase the risk of developing prostate cancer in certain cases. Hormonal imbalances, including an accumulation of anabolic hormones, are believed to contribute to the development of BPH. Several risk factors may heighten the likelihood of developing BPH, including a family history of the condition, obesity, and other medical conditions such as diabetes and heart disease. It is crucial to seek medical attention if you experience any symptoms associated with BPH. Early diagnosis and treatment can help prevent complications and enhance your overall quality of life. In this informative video, we will delve into 6 essential nutrients that have the potential to aid in prostate shrinkage. These nutrients encompass a range of elements such as foods, vitamins, minerals, and herbs, all of which we will thoroughly examine. Additionally, we will provide insights into straightforward lifestyle modifications that can effectively address the root causes of prostate enlargement. Be sure to stay tuned for valuable information and actionable tips. Let's begin our exploration of essential nutrients with zinc. This mineral holds significant importance in the realm of shrinking an enlarged prostate and maintaining a healthy balance of male hormones. Zinc plays a vital role in thwarting the conversion of testosterone into estrogen or dihydrotestosterone, DHT, by inhibiting specific enzymes like aromatase and reductase. By doing so, it helps rectify hormonal imbalances that contribute to prostate growth and diminish inflammation within the gland. To ensure an ample supply of zinc, consider incorporating whole food sources into your diet. Options like oysters, beef, pork, chicken, beans, nuts, pumpkin seeds, crab meat, organ meats, watermelon seeds, and sugar-free dark chocolate can provide you with this beneficial mineral. Alternatively, you may opt for a daily supplement containing 30 mg of zinc chelate, zinc bisglycinate. However, exercise caution not to exceed the recommended dosage, as excessive zinc intake can deplete copper levels. If you choose to take a zinc supplement, it is advisable to supplement with copper as well, preferably in the form of a blend of trace minerals. This ensures a balanced intake of these essential elements. Next on our list is vitamin D, a crucial nutrient for maintaining optimal prostate health. Scientific studies have established a correlation between low levels of vitamin D and an elevated risk of prostate enlargement and prostate cancer. Vitamin D plays a pivotal role in regulating cell growth, mitigating inflammation in the prostate gland, and balancing male hormones such as testosterone, all of which are vital for prostate health. To boost your vitamin D levels, you have a couple of options. Firstly, you can expose yourself to sunlight, which helps your body naturally synthesize vitamin D. Additionally, you can incorporate vitamin D-rich foods into your diet, including fatty fish, egg yolks, and fortified foods. However, it's important to strike a balance when it comes to sun exposure. Excessive exposure to sunlight can lead to skin damage and increase the risk of cancer. Therefore, it is crucial to be mindful of the time spent in the sun and take precautions such as wearing protective clothing and applying sunscreen. If you find it challenging to obtain adequate vitamin D through sunlight and diet alone, supplements are available as an alternative. The recommended daily intake of vitamin D typically falls within the range of 600 to 800 IU, international units. Next up is saw palmetto, a natural herbal supplement with a long history of promoting prostate health, dating back centuries. Research has indicated that saw palmetto can help alleviate symptoms associated with an enlarged prostate, including frequent urination, weak urine flow, and incomplete bladder emptying. One of the primary mechanisms by which saw palmetto operates is by blocking the production of 5-alpha reductase, an enzyme responsible for converting testosterone into DHT, a hormone that can contribute to prostate enlargement. Through the inhibition of this enzyme, saw palmetto aids in reducing the size of the prostate gland and improving urinary function. For prostate health, the recommended daily dosage of saw palmetto extract typically ranges from 320 to 480 milligrams. However, it is essential to note that the results of saw palmetto, like any other natural supplement, may not be immediate. It may take several weeks or even months to observe noticeable improvements in prostate health. When choosing a saw palmetto supplement, it is crucial to opt for a high-quality product sourced from a reputable supplier. This ensures maximum effectiveness and safety. Moving on to number 4, we have Pygeum, an herbal supplement derived from the bark of the African cherry tree, scientifically known as Prunus africana. Pygeum contains a range of bioactive compounds, including phytosterols, fatty acids, and triterpenes, which offer potential benefits for prostate health. Studies indicate that Pygeum may help alleviate symptoms associated with an enlarged prostate, such as urinary frequency and difficulties with urination. For optimal results, the recommended daily dosage of Pygeum extract typically falls within the range of 100 to 200 milligrams, to be taken in divided doses. Let's move on to number 5, which is lycopene. This bright red pigment is naturally present in a variety of fruits and vegetables, including tomatoes, watermelons, and papayas. Lycopene serves as a potent antioxidant, shielding cells from damage caused by harmful molecules known as free radicals. Research suggests that lycopene offers a range of health benefits, including support for heart health and a reduced risk of certain types of cancer. Moreover, lycopene may contribute to maintaining prostate health in men by reducing the risk of prostate cancer and alleviating symptoms associated with an enlarged prostate. Lycopene supplements are available in various forms, such as capsules and gummies, providing convenient options for consumption. The recommended daily dosage of lycopene can vary depending on the specific supplement and the condition it is intended to treat. Typically, the recommended range falls between 10 to 30 milligrams per day. Lastly, we have number 6, which is beta-sitosterol. Beta-sitosterol supports prostate health by inhibiting the activity of 5-alpha reductase, the enzyme responsible for converting testosterone into DHT, a hormone associated with prostate enlargement and related symptoms. Although beta-sitosterol can be found naturally in various foods, it may not provide sufficient amounts to achieve the desired health benefits. In such cases, a beta-sitosterol supplement can be a suitable option. For prostate health, the recommended daily dosage of beta-sitosterol extract typically falls within the range of 60 to 130 milligrams, to be taken in divided doses. To increase your intake of beta-sitosterol through dietary sources, consider incorporating more nuts, seeds, fruits, and vegetables into your meals. Nuts such as almonds, pistachios, and walnuts are good options, while pumpkin seeds and sesame seeds are particularly high in beta-sitosterol among seeds. Fruits such as avocado and grapefruit contain beta-sitosterol, and for vegetables, broccoli, Brussels sprouts, and spinach are excellent sources. By including these foods in your diet, you can naturally enhance your intake of beta-sitosterol and support prostate health. However, before we delve into the steps to shrink the prostate, let's take a moment to understand the underlying causes. Causes 1. Hormone imbalance. Excess body weight or obesity can lead to elevated levels of estrogen and insulin, which are hormones that can contribute to prostate gland enlargement. An imbalance between testosterone and other hormones like estrogen or dihydrotestosterone, DHT, can also play a role in prostate enlargement, a condition that can occur naturally with age. Causes 2. Weakened stomach acid. As we age, the strength of our stomach acid diminishes, potentially affecting our ability to absorb essential nutrients, including zinc, which is crucial for a healthy prostate. Causes 3. Consumption of dairy products. Excessive consumption of dairy products may contribute to prostate enlargement due to their high content of prolactin, a growth hormone that can worsen the condition. It is advisable to moderate or limit the intake of dairy foods. Causes 4. Poor diet. A diet rich in refined foods such as sugar, processed grains, and non-organic foods containing chemical pesticides can disrupt hormonal balance and lead to liver damage. These factors can contribute to prostate enlargement. Causes 5. Certain medications. In some cases, certain medications like diuretics used for blood pressure management and antihistamines prescribed for allergies may contribute to prostate enlargement in men. Understanding these causes is crucial in developing an effective strategy to shrink the prostate. By addressing these underlying factors, we can take proactive steps towards prostate health. Now, let's explore 6 effective approaches to balance hormones and reduce inflammation, ultimately aiding in the shrinkage of your prostate. 1. Incorporate organic cruciferous vegetables. Include organic cruciferous vegetables such as broccoli, kale, and cabbage in your diet to support both overall health and prostate health. These vegetables are packed with essential nutrients, phytonutrients, and antioxidants that help reduce inflammation, inhibit cancer cell growth, and facilitate the elimination of abnormal cells. Moreover, cruciferous vegetables assist the liver in removing excess hormones from the body, which can contribute to hormonal imbalances and prostate enlargement. 2. Avoid inflammatory vegetable oils and dairy products. Another important step is to steer clear of inflammatory vegetable oils and dairy products, as they can contribute to inflammation and potentially hinder prostate health. Instead, opt for healthier alternatives like olive oil, which offers anti-inflammatory properties, and plant-based milks, which are gentler on the body and can help maintain prostate health. Making these choices can significantly support your overall well-being. 3. Incorporate yoga exercises for prostate health. Another beneficial step is to add specific yoga exercises for prostate health to your routine. One simple exercise is known as the Ashwini Mudra or the horse gesture. Here's a guide on how to perform it. Step 1. Find a comfortable seated position with your legs crossed and your spine straight. Step 2. Close your eyes and take a few deep breaths to relax. Step 3. Contract and relax the muscles in your anal sphincter, the muscles that control bowel movements, rapidly for 10 to 15 seconds. Step 4. Release the contraction and rest for a few seconds. Step 5. Repeat the process of contracting and relaxing the muscles for 5 to 10 rounds. Step 6. After completing the rounds, take a few deep breaths and allow your body to relax. For more detailed instructions and guidance, please refer to the description box below the video. You'll find a link to this exercise as well as additional resources that have proven helpful for many men dealing with prostate enlargement issues. 4. Eliminate processed foods and embrace whole foods. Processed foods that are high in sugar, unhealthy fats, and additives can trigger inflammation within the body, potentially impacting the health of the prostate gland. To promote prostate health and overall well-being, it is advisable to adopt a whole food diet. This entails prioritizing fresh fruits, vegetables, lean proteins, and whole grains. These whole foods are rich in essential nutrients and possess anti-inflammatory properties, aiding in the reduction of inflammation and supporting optimal prostate health. 5. Engage in high-intensity interval training, HIIT. High-intensity interval training, HIIT, which involves brief, intense bursts of physical activity alternated with periods of rest or low-intensity exercise. HIIT is a highly effective form of exercise that enhances cardiovascular health, boosts muscle strength, and reduces inflammation throughout the body. Engaging in regular exercise, including HIIT, has been associated with a reduced risk of prostate cancer. Remarkably, dedicating just 10 minutes to HIIT sessions twice a week can improve testosterone levels and contribute to a healthier prostate. 6. Incorporate pumpkin seeds into your diet. Not only are pumpkin seeds a delightful and nutritious snack, but they can also contribute to shrinking the prostate. Pumpkin seeds contain beneficial compounds called phytosterols, which have demonstrated the ability to reduce inflammation within the prostate gland and promote a healthy hormone balance. Furthermore, these seeds are an excellent source of zinc, a vital nutrient for prostate health. 7. Embrace intermittent fasting, which is a dietary approach characterized by alternating periods of fasting and eating. Intermittent fasting has been proven to offer numerous health advantages, including improved blood sugar control, weight loss, and reduced inflammation. Moreover, it has been associated with a lower risk of prostate cancer and aids in the cleansing of the liver from excess fat. There are two popular methods of intermittent fasting, the 24th method and the August 16th method. For instance, the 16-8 pattern involves consuming meals within an 8-hour window and fasting for the remaining 16 hours. This can be achieved by, for example, eating between 12 p.m. and 8 p.m. and fasting between 8 p.m. and 12 p.m. the following day. Intermittent fasting benefits prostate health by regulating hormone levels in the body, which plays a significant role in maintaining a healthy prostate. By adopting intermittent fasting, you can harness its potential advantages for overall health and support your prostate health in the process. Thank you for watching, and we hope you found this video insightful and inspiring. If you enjoyed the information shared, be sure to like and subscribe to our channel for more valuable content on health and nutrition.